everyone. Hope you all are doing well and safe, and welcome to this webinar. I'm Akansha Sahai, Project Manager at Rehab Path India office. And we are a Madison-based startup with a mission to help patients and families fight addiction. So we connect the families and patients with the right rehabilitation center, and currently we work with around 1,700 rehabilitation centers in India. And in today's webinar, we will be discussing insight into the role of environment and comfort in recovery with Safe House Wellness. And our guest speakers are Ms. Shraddha Banerjee, who is a clinical psychologist, and Dr. Anant Agarwal, who is a psychiatrist. And we have Rajnandani Rathod, who is a part of a team and who is also a psychologist, and she'll be driving today's webinar. So this is going to be a one-hour session, so please feel free to drop your questions onto our Zoom and Facebook page, and we will be taking them at the end of the sessions. Over to you, Rajnandani.
Yeah, thank you, Akansha. And thank you, Ms. Banerjee and Dr. Agarwal for joining us. So before we get into the questions, maybe can you introduce yourself to our audiences? Ms. Banerjee, we can't hear you. Maybe you're on mute. We still can't hear you. Can you try without the earphones, maybe?
Is okay now?
Yeah, now we can hear you.
Okay. Yeah, so Dr. Agarwal, you start the introduction. Then I'll.
Okay. Sure. So, hello everyone. So, hi Rajnandani and Akansha. So, I'm Dr. Anant Agarwal. I am a consultant psychiatrist. I've been in the field of, I've been in the medical field for over a decade now, and I've been in the field of mental health for over 6 years. I have been associated with various rehabilitation centers in Delhi and NCR, and I have been with Safe House for over a year now. I majorly practice in the field of de-addiction, but I also see patients in related to anxiety disorders, depression, bipolar disorders, schizophrenia. But my expertise majorly lies in substance use and substance dependence. So I've been practicing in Delhi NCR and majorly associated with Safe House Wellness Retreat.
I am Ms. Shraddha Banerjee. I am a RCI registered clinical psychologist. I am a licensed clinical psychologist. I have been practicing in Delhi for last 10 years and associated with the Safe House from 2015. Apart from substance, I also work in other areas like marital interpersonal psychotherapy, adolescence issues, and mood disorders and other areas. I also worked in previous, I've worked in other reputed organization. I have also experience in as a guest faculty also. I worked with some leading universities in Delhi.
Oh, yeah. Thank you for that introduction. And I'm really looking forward to having this conversation, like after hearing your background now. So let's get into it. Can you first tell us a little bit about the Safe House Wellness Retreat and what makes it different from other rehabilitation centers?
Okay. Safe House Wellness Retreat or Safe House Premium is located in a colonial estate type of facility. It is a farmhouse kind of facility, and here it is kind of like 2.5 acres of property. It's a very open, close to nature, and very pleasant, peaceful environment all throughout. And also there are we doesn't have too much, don't keep too much of client here because we believe in mostly individualized treatment and customized treatment, and most of the clients who come here are voluntary clients. Mainly we accept voluntary admissions only, those who give their consent for treatment, those only. And it's stand up in India. Mostly the centers are confined environment or closed environment. In that respect, we are definitely different from the other rehabs. Apart from that, the approaches is quite different in safe house. So we mainly practice three modalities here. The psychiatric modality, which Dr. Anant is Dr. Anant's forte, the clinical psychology, which is mine, and the Alcohol Anonymous and Narcotic Anonymous 12-step program. So in if you ask about the difference, so one thing for sure, we don't impose any of the modality on our client. We, in the beginning, we try to motivate our client to participate in all the session, and then the client can choose which modality is actually they can relate. Sometimes it has been seen that people are doing good in their recovery, but they are not that much relating to the Alcohol Anonymous 12-step program. And sometimes some patients are relating very well with the psychiatric modality. So there we give the client to choose what modality. There is no rigidity in, there is no, like, we don't believe in any stigmas that only this thing can help, only Alcohol Anonymous 12-step program can help, or only psychiatric drugs can help, or clinical psychology can help. So we think that all the three modalities play their part in the recovery process of every client. And with that belief, we practice very cordially the we three professionals. We also have very senior Alcohol Anonymous counselor with us, who practice his way of treatment, his approach. So we work very cordially here with our clients. So yeah, in that respect also we are different. We are not imposing anything. And the second thing, we mostly believe in developing skill power during the process of recovery, rather than following a particular modality or believing in modality. There is nothing in our facility. There is nothing, this thought process is not there that if you are not following this, then you won't get into recovery or this thing. So yeah, so we encourage all the client, their requirements, their needs are the priority.
Okay, that sounds like a very interesting approach, because it seems like a lot of autonomy is given to the client based on how they are progressing and based on their experience.
Yes.
And you also spoke about environment, so which brings me to the topic of our webinar today. So what is the role of the environment in recovery?
See, not only in the substance abuse, in mental health, environment always plays an important part, a vital part, you can say. So, like any other chronic diseases, where we try to facilitate the client so that the client can feel free and all. So, in case of any mental illness, the environment should be open. It should not be imposing. There should be freedom, a little bit of comfort should be there, that there should, the environment should not be confined. So in my 10 years of experience, and from 2015 I'm working with Safe House, I have seen that confined environment actually bring the rebelliousness or the defensive attitude in client. Okay, the more focus is on the deficits in the environment, where this thing is not provided, that thing is not provided, rather than focusing on their recovery, developing more insight, and then introspection, which is very important to accelerate the process of acceptance. So acceptance is the first step of recovery. So if the client is preoccupied with the environmental deficits, so definitely it is not going to help in building up their acceptance, in building up in their introspection process, which is necessary. So environment plays a very important role, and here in Safe House we provide very, like, almost all kind of luxury facilities, amenities. We try to make them comfortable as much as possible. So definitely it help. According to our experience, it help in their recovery, and they also come up for follow up because there is no pressure. They like we have very good follow up rate because there is no pressure from the people who are treating it, like you have to do this or you have. So there is like a freedom which they can feel and a peace inside. Yeah.
Mhm. Right. So, like you said, like a confined environment sort of brings out rebelliousness within the clients. Could you possibly like tell us about some other environmental stressors that hinder the process of recovery?
Dr.
Yeah,
Agarwal.
so so there are, like we talked about environment, like we talked about the confined space. This particular aspect in terms of treatment modalities as such is being studied for a long time now, and majorly has increased in the last few years. So the world around is trying to find out whether the environment in terms of the treatment, uh, you know, anyhow contributes in any ways contribute to the patient outcome or patient satisfaction. There have been many studies which have been done in various countries, which have been shown to clarify these factors or these outcomes as such when we talk about environment per se. So, like Shraddha ma'am definitely clearly said that environment has a significant role to play. Environmental stressors also have been identified many studies, and in particularly hospital environments, and in terms of stressful events also. So majorly there are four different types of stressors that have been classified in environmental stressors. The first is cataclysmic events. So cataclysmic events are basically catastrophic events like earthquake and fires and etc., which we don't really concern ourselves with. But the rest three are very, very important when it comes to an environment in a rehabilitation center or any hospital setting as such. These three are stressful life events, daily hassles, and ambient stressors. So when we talk about stressful life events, we are talking about a day in the life of a person who is dependent on substance. Every day starts with a stressful life event, and it ends with a stressful life event after having a drink or after consuming the substance. So stressful life event in itself forms quite a large part of the day of of a person who suffers from substance dependence. The next we would talk about is daily hassles, which even Ms. Shraddha mentioned, that daily hassles are where you are having a conflict with what to do and what to do with the space, and you are not comfortable in your day-to-day life. And the third is the ambient stressors. There have been multiple number of studies done on ambient stressors, like, for example, noise, pollution, crowd, parasites, confined space. And these studies have all reflected that this is the major stressor that affects anyone, even in day-to-day life. In day-to-day life, if we are working or if we are staying somewhere, and there is a noise which is coming in the background from the air conditioner, from the fan, this is something which disturbs all of us. But we don't really pay attention to these things, these details in our homes, right? Or we have paid so much attention to them that we have sort of, you know, stopped paying attention to them so much, and we have, as such, carried on with our works. But when you come into a rehabilitation center, the patients who are already going through a lot of stress, a lot of stressful events, they when they come to a rehabilitation center, they want to be in a peaceful environment. When these ambient stressors are present and when these daily hassles get on top of that, everything makes the environment even more stressful. So the purpose of providing a luxury rehab and the purpose of providing a comfortable environment is that you remove these stressors, you minimize them as much as you can. So you remove the noise, you take care of the daily hassles, you reduce the pollution. So like safe house is basically, like ma'am said, it's a farmhouse. It's located in a place which is surrounded by farms, and so the pollution, it's away from the city, so the pollution is very less. The day-to-day traffic noises, the other noises from your surrounding buildings, neighborhood are less. There is nothing There's no working machinery which is work all the way constantly working around. So it's a very peaceful environment. So these studies that have been done in general hospitals in the US have shown that the parameters like sleep, pain, stress, and many other factors that have been studied in patients, these outcomes become even more better when they are surrounded in such an environment, which is peaceful, which has a lot of natural light, which has indoor plants, which the brightness of the rooms is there, ambient light is there, and uh, there is no medical equipment. So safe house has been designed to look like a home, and we try and keep the comfort level also like anyone would expect at a home. So like I would expect a normal comfort at my home, that is what we try and provide in the treatment process as well.
Okay, but that does sound like a very comforting environment. And like when we were speaking of environment, I realized that like when suppose it's raining or the weather is gloomy, it affects your productivity also. So when you're
Yes,
in a vulnerable and stressful situation already, and uh, some other environmental stresses happen, I'm sure it has a much harsher impact on those people, right?
definitely.
So you sort of also covered the next question that I was going to ask, but if you would like to add anything to it, I was asking what is the environment in Safe House like, and how does it help the patients?
Yeah. So the environment, as I said, that it is very close to nature, surrounded by nature, is pollution free, is away from the city, it's a little isolated, and like it's a big property where the patients also carry out their physical activities and playful activities, all this thing. And safe house also filled with various luxury amenities, like starting from the room, which is like very like comfortable room with a king size bed, jacuzzi, bathroom, private balcony, and other stuffs like coffee maker, air purifier, all these things are there. And then we have like swimming pool, multi-equip gym, all these facilities are there. So laundry services, Wi-Fi services, Fire Stick, Apple Fire Stick. So all these small things are adding up the facility to the comfort. Small things which they enjoy, the client enjoy in their pastime when there is no sessions. They enjoy those things, using those things, and there's lots of uh, comfortable, like our whole team is like very friendly with our clients also. Now we have chef also. The service of the kitchen team is also very nice. The room services are also available, and also we have a very big dining space where they can have their lunch or dinner, breakfast together. So yeah, so this the kind of facilities we provide here, and it makes their journey little pleasurable, little enjoyable. So they need not to focus on, okay, like whether there will be any issues in the room, or not comfortable in the room, or bathroom is not clean, because housekeeping is always there to take care of the cleanliness and hygiene. So we as a professional have lots of opportunity to make them focus on different other aspects of, like how to modify their personality, how to uh, bring inside, develop inside cognitive changes and all these things. So there are lots of opportunities for us because of this environment. And it helped them also to participate, contribution. It increases the contribution from client side.
Mhm. Okay. That does sound like a luxurious getaway that even I would like to take.
Yeah.
Um, yeah, it does sound like a very comfortable environment, like everything is taken care of. And now I've understood that the environment and all of this comfort sort of reduces the amount of stress or other stressors, external stressors, which can be controlled. But in terms of the recovery, so how much does comfort matter in terms of the speed of recovery?
Um, should I answer, Dr. Agarwal, or you will answer?
Yeah, I think you can answer.
Okay. So I think definitely it accelerates the speed of recovery. There is no doubt. When like if you can if I'm in this environment which is very comfortable and I'm able to focus on different things, definitely it will accelerate the recovery speed, and it will help the client to focus more on the lifestyle modification and other psychological changes which we are also focusing or targeting. In our experience, as I said, that we have very good follow-up rates which are increasing day by day. And like I think that the environment also playing a good role because of this freedom, friendliness, peaceful ambience. People love to come here again for follow-up sessions, continuing the sessions. So also this environment which is like the comfort, the facilities is also helping them in novelty seeking behavior also. Like clients of addiction, they have this tendency of novelty seeking behavior. So as we have lots of thing to do here, like as I said, it is there is a multi-equipped gym, swimming pool, table tennis, billiards, indoor games, outdoor games. So there are different things which the client can practice. Their physical activities, routine, they can enjoy also. It's not like monotonous. The boredom. So the boredom is a very important cause of relapse again and again. Boredom is an important hindrance in the process of recovery. So they learn how to practice alternative ways or replace the earlier way of uh, their earlier way of lifestyle or earlier lifestyle. They learn new things, how to make themselves preoccupied rather than complaining all the time about I'm not having this, not having that. So they get all this thing and also practice a lot of thing, involve themselves in lot of activities. Definitely this facility is speeds up or accelerate the recovery.
And I would like to add one more thing that definitely because of this, you can understand that recovery is not a one-time process. It's not just that you reach a rehabilitation center and you are recovered now. I think it's a journey and it's a ongoing process which happens over a long period of time, even after you when you have left the rehabilitation center. So that is another thing, that when you have had a comfortable environment when you stayed at the rehabilitation center, you would want to come back for follow-up sessions. I've seen in many rehabilitation centers that the follow-up is very poor because patients rarely want to come back to the same place where they didn't feel comfortable. So now that they have an idea what the comfort level would be like, they like returning back to us. They like coming back and sitting and talking to us in a comfortable environment, and that changes a lot of things. So the follow up is something which is very important in terms of recovery as such.
Okay. Yeah, that does sound like having autonomy and having so many things to look forward to and really enjoy while you are in the process of recovery makes you look forward to life, right? It makes the whole process more zestful and
Right.
engaging. So, okay. Like you also mentioned that there is a chef and the nutrition is also, given a lot of importance. So that's my next question. What is the role of nutrition in withdrawal management?
Yeah, the biological
Should
aspect, Dr. Agarwal
Yeah.
will tell.
So I would say that when we are talking about nutrition, it's something which many of us neglect as such. It's usually something which is overlooked when we are going for rehabilitation. We are just focusing on the treatment modalities and just staying away from the substance as such, and we are not focusing on a holistic approach. But when we talk about a holistic approach, nutrition becomes an important area because, as such, if you understand hunger is the most basic instinct, and food is something which all of us require to normally maintain our body functions. So when you are coming in a state where you are not healthy mentally as well as physically, because substance use leads to both deterioration in mental health as well as physical health. So nutrition becomes more important because you have gotten into a lot of nutritional deficiencies because of not eating properly during the substance use, having a lot of nutritional deficiencies due to malabsorption during the substance use. And as such, the patients end up with a lot of chronic medical illnesses like hypertension, diabetes, because of the substance use. So nutrition plays an important role because all of these aspects require specific nutritional modifications to be made to the patient's meals. So definitely nutrition is an important part, and if it's mostly overlooked, we are not focusing on the diet of patients. There is no regulation on how much a patient is eating. Sometimes patients patients might not really be having a good appetite. Their appetite is reduced, or as an aftermath of the withdrawal symptoms, their appetite is significantly increased. So we try to focus on the nutrition and diet aspect in terms of regulating what they are eating. We sit down with them, we try and make a diet chart, try to understand their dietary requirements. Like Ms. Shraddha said, that there's a chef there who tries to cater to everyone's individual needs. The previous day, the next day's menu is decided. The patients sit together and they discuss what they want to have, and it's made in a very healthy way. It's made in a less oil-based, medium, and they try and cater to the individual nutritional dietary requirements. Like, for example, if a patient with diabetes comes, so at most rehabilitation centers, we start neglecting these things. And this is something which I have experienced. And the patient also sometimes doesn't understand that how they have to look towards their dietary modifications. So, for example, a patient with diabetes comes, we have sugar-free available with us. We try and make food without, the addition of a lot of high glycemic index foods. So we try and cater to each and every nutritional requirement as and when the patient comes.
So, like as Dr. Agarwal said, mentioned that lots of patient come with the medical condition, like patient with liver cirrhosis, or so. In those case, pancreatitis patients also come. So, in those case, gastroenterologists also give dietary instruction. Those also like our chef is also aware of those things, and also we are associated with nutritionist also who help us in making the diet chart according to the instruction given by the treating gastroenterologist. So accordingly the food will be prepared by the chef, and lots of focus on juices, liquids, all these things are also there. Less oil, doctor mentioned already. And especially like the food can be customized according to the dietary needs of the client. So yes.
Okay, okay. So the treatment sounds very holistic, where everything is, tailored, met to the client's needs.
Yes.
Not just the treatment process, but also nutrition, which might be ignored in most other places. Okay. Okay. So my next question is, how is anonymity maintained in case of high-profile clients?
So anonymity or confidentiality in mental health, maintaining this as a cycle, you also know very aware that it is the first criteria, and we should maintain. In case of high profile clients, what I have experienced after like a safe house started with this luxury center, what we have experienced is some clients also demanded of like booking the whole place, and not to disclose their identity to anyone. Some of the clients recently also, we had one client who completely who requested us not to mention his name on the file also, only like complete anonymity. So in high profile cases, like in the past, we have celebrities, political people, those kind of people was there in our facility. So those people definitely they need their privacy, and they need the confidentiality, and we respect that, and we follow whatever is required. So yeah, so in the past, lots of these things we also faced, and it is like we maintain those things.
We also try and keep, so when the patients don't want to intermix with other people, and sometimes patients keep specific demands that they would not prefer to keep group sessions, which we keep them once a day or alternate days. So some are group sessions, some are individual sessions. A lot of times patients, for their anonymity, they prefer not having group sessions where they don't want to discuss about their lives. So we take individual sessions with them. We try and understand their needs, and we don't call them out for group sessions. We sometimes take sessions in their rooms or in a private space where they don't have to be exposed to the other patients, so that the anonymity remains.
Okay. All right. So I have a more general question now. How should one choose the right rehab for themselves?
Okay. So see, when we are trying to choose a rehab, I would say there are a lot of factors that you have to consider before you decide on which rehab you have to go to. The first and most important one, I would say, is definitely the treatment modalities. You would definitely want, apart from the comfort and luxury and environment, that's all secondary. The first thing has to be, you have to see the treatment, right? So the treatment, the quality of treatment that is given at a rehab is of utmost importance. The right rehab would be which, for a particular person, would be different. So there are different ranges of services or different ranges of treatment modalities that we follow. So to choose the right rehab, you have to see what suits you, whether you want to go for psychiatric treatment, whether you want to go for psychological aspects, whether you want to go for 12 step. This is something which you have to see. What do you relate to the most? If you are already aware about it beforehand, then you choose a rehab based on the available modalities. But let's say you are going to the rehab for the first time, you don't know what you are looking out for. I would say that you choose something where you have a range of treatment modalities available, where you can choose from whatever treatments are being followed. You get to experience all the modalities, but you can choose which ones you want to follow and which ones you don't want to follow. So I would say that, like, for example, the major treatment modalities that are followed are 12-step program, then the psychiatric treatment and psychological treatment. Apart from that, there are many yoga and meditation based centers, and a lot of nutrition based centers. So you have to see that, try and find a place where a lot of things are clubbed together at one place. That would be the first thing. Then the next would be, obviously, you have to look for the level of comfort. You have to see whether you will actually be able to focus on the treatment or not. So let's say you have all the modalities, but you are not comfortable. You are in a confined space. You have been forced to attend all the sessions. You have been forced to, even listen to 12-step or psychological assessments and psychiatric medications, even when you don't want to. So that would be something which would be detrimental to the treatment. So this would be the next thing that you look out for, that what's the comfort, what's the environment, would you be able to recover in such an environment or not? And more importantly, the recovery takes some time. So you are there admitted in a rehabilitation center for at least a few months, at least a month. So it has to be comfortable, otherwise you won't be able to stay there for long. The next, I would say, would be based on recreational activities. So you have to next look for activities, the range of activities that are available, because you can't just keep yourself engaged in sessions the entire day. You have to have something to do when you are free from your activities, and to be able to build your lifestyle, which you will take home from here. You won't be continuing sessions all day round, right? So when you go back, you won't be having 12 step and psychological counseling and psychiatric sessions every day. So you need to build up your day-to-day routine. So a place that provides such a environment or such a opportunity for recreational activities to build your lifestyle would be the next factor, which I would say. And the last would be, I would say, food and safety. So food would be important. What sort of a nutrition program the rehabilitation center follows, that is one thing. And safety obviously is another. So safety means that you are surrounded by like-minded people. There is a less risk of conflicts in between the patients as well. So that is also something which is very important, and safety of the center in general. So I would say these are the factors that you should consider while choosing a rehab.
Okay. I think that must have been very helpful for our audience. It was very informative. Okay, coming back to the Safe House retreat, what are the elements of the basic treatment plan?
Okay. So when we talk about the basic treatment plan, we try and follow an initial fixed, base, and then we try and cater it to more of a patient-oriented, individual-oriented treatment plan. So the basic treatment plan is that whenever any patient comes in with us, we do a primary assessment. The assessment is done by me as well as Ms. Shraddha. We do the psychological assessment as well as a basic psychiatric assessment at the intake. Then after that, we try and analyze the factors. So we try to identify whatever the other triggers and factors, and then the treatment plan is made for each individual patient. And these are tailor made. These are customized to each patient. There is no rigid plan that is made, which we have already made, and that's every patient is fit into that. Rather, we make a treatment plan which is fit to different individuals based on what their need is. So the treatment plan, the basic treatment plan, has 5 major elements that we try and include. One is the psychiatric assessment and treatment, which includes the detoxification and withdrawal management with medicines, which is followed by then the biological understanding of the biological mechanisms of addiction, which is my part, which I take. Then next is the psychological evaluation, where we try to identify the factors and triggers for substance use and try and build up skills in the patient in various areas like coping skills, communication styles. We try to work on their cognitions, and then we work on the relapse prevention. So this is the second modality that we try and incorporate. The third is the 12-step program, where the counselor from AA comes, and they are part of the treatment program. The fourth modality is yoga and meditation, which is also a very inherent part of our treatment plan. We try and motivate the patients to definitely attend yoga sessions and meditation sessions so that they generally have a relaxed day. And the last would be lifestyle modification. So where we mentioned nutrition, diet, dietary modifications are done, recreational activities are scheduled, exercise and using the gym is scheduled, and a daily schedule is made. So this daily schedule again is tailor-made to each individual patient according to them.
Okay. All right. So that's like a whole team of people working for the client based on their own needs. Okay.
Yes.
So I've heard that most popularly the 12-step program is what is used in a lot of centers. So what is your take on the 12-step program, and have you modified it in any way?
So yes, 12-step program is very popular, and there is a paradigm also, like without a recovery can't come. So here, like, we believe that all the three modalities are important, and there are certain concepts of Alcohol Anonymous which are debatable. Like one must reach to the rock bottom to come to recovery. So I, as a professional, can't discard any of the concepts or any of the, but yes, some of the concepts which are very very helpful, like building up the acceptance, accepting the powerlessness, working on your resentments in step 4, step works. All these things I incorporate in my cognitive behavior therapy sessions. So I believe, or I, whatever I have studied and also attended various meetings as a psychologist, I think that cognitive is Alcohol Anonymous big book is like quite similar like cognitive what we do in cognitive behavior therapy. We are trying to change the cognitions, and then we are trying to address the behavioral changes. So it's quite similar. So I try to incorporate those concepts also in my cognitive behavior therapy sessions, those which are really helpful according to me or according to other professionals also. That modification we do. But yeah, definitely Alcohol Anonymous has their own style of work which nobody can discard. Lots of people get help from that. But yeah, some of the concepts are debatable, that I must say.
Okay. So, like we've spoken about the environment at the safe house and the whole treatment plan and everything. So, could you tell us what a typical day at the safe house is like, and what do clients usually like the most about their stay there?
Uh, So when we talk about a typical day at Safe House, I would say again that it's a lot based on how the individual wants it to be, how an individual patient wants it to be. But usually there are some things which are fixed and which we try and motivate the patients to follow as such, so that they can get into a good routine, good daily routine. So normally when the patients wake up, they're served breakfast in the morning. And along with that, patients who prefer exercising in the morning, they can go to the gym and do some exercise before their breakfast. That is the usual time. So the breakfast is usually done by the time of 10 o'clock. After that, the counselor from A usually visits in the facility. So during the daytime, from 10 to 1, usually the sessions are there with the AA counselor. These are individual sessions also to cater to some patients who would prefer having individual sessions, and then there are group sessions on the 12-step program as well. And then after that, we have sessions either by Ms. Shraddha, or I take sessions on the biological aspects or on the psychological aspects. We both try and coordinate between us for the sessions. In between, when they get a break, they have their lunch usually at 2 o'clock, between 2 and 3. And they also a lot of people try and squeeze in some recreational activities like playing a short game of pool or table tennis before between the two sessions. So after that, by the evening time, usually the entire staff also loves to play cricket. So they get together with the patients and play cricket with the patients at around 5 in the evening. And by the time they are done, then it's time for the yoga session. So we have a yoga trainer with us who comes every day. So it's a group yoga session which is there in the evening. After that, we usually give the patients a time to relax away from the sessions, in their comfort, in their rooms, or in the common areas where they can interact with each other, share ideas, play with each other, and uh, play indoor games, play outdoor games, or go for a swim in the swimming pool. So this is the usual day that at Safe House.
So in the
You
beginning,
asked,
yeah.
yeah,
So I
please
just
go
want
ahead.
to add one point. So when the client is like join the program, so we make the activity schedule according, but like we sit with the client and ask their interest and what kind of recreational activities they want. So some people are very early riser. They get up at 5 o'clock. Then they want their own coffee. So there are coffee maker in every room. Some people are little late riser, but there are fixed time of lunch, dinner, and breakfast. So they have to follow that. So accordingly, we make an activity schedule following all the cognitive behavior therapy rules, how to make the activity schedule, considering the interest and the hobbies of the client. And we try to cater all the interest and hobbies of the client, definitely. Yeah, doctor.
Yeah, okay.
So, yeah, I think that sums it up. perfectly.
And the second part of my question was, what is it that the clients or patients over there like the most about their stay? Like, from what is their feedback?
Okay.
So I would say that they definitely like the sessions as such, and the most the thing that they like the most is that the autonomy, like you said, the autonomy that they get in choosing their own treatment plan, in choosing what they want to do the entire day, how they want to spend their day, that like they would do at their home. And I think the thing that is appreciated the most is that patients are allowed their phones, their laptops, they are allowed to continue their work, because the patients that come to us for their treatment are businessmen, like ma'am said, celebrities, political leaders, and very busy personals come to us who are working and who don't want to give up on their jobs. So we provide them the facility of carrying on with their phone and laptops and their meetings. So this is something which I have found that is the most appreciated by patients.
Okay. All right, that does sound like the whole conversation has made me feel like I want to visit Safe House myself.
You are definitely
Um,
welcome.
Yeah.
okay.
So,
The-
yeah, Raj Nandini, one thing I also want to add, like we also organize small events or get-together with for clients, like barbecue beside the swimming pool, or in small dance sessions. We staff also participate in that. So that freedom also, like people like it very much. Like they can do this kind of stuff, and there is a motive also behind organizing this. So there is an association between substance and the pleasure. So we are trying to address that also in the environment, because we have a facility which actually allow us to do different things for our client. So we have this because we have a good chef, so we organize snacks party also when a client completed their 90 days staying. So we give throw a party or a good dinner, lunch with good music and or barbecue poolside. So all these things we arrange so that they find it like pleasurable, or it's like it should be sense of accomplishment should be there. So that is important.
All right. Yeah, it does sound like, it reminds you how beautiful life is, like in a very creative way. It's treatment in a very creative way. And also, when you feel like you have autonomy, you are deciding how your treatment plan is going to be. It makes you feel like you have control of your
Yeah.
life. And it's not just someone who is just treating you and making you feel better.
Right.
All right. So during the time of the pandemic, I know the workings have changed for everyone. So how have you extended your care towards and services towards your clients and patients?
So, like any other time, I think our services have continued similarly during the pandemic. More so, I would say, because this was a time of great mental stress as such for a lot of people, and it saw a significant rise in the substance use disorders as such. So, we also could see that by the inflow of patients that we had during the pandemic, and a lot of them were concerned about the ongoing pandemic, and there was a fear of getting the COVID infection. So we catered to them, and we tried to make our services such that we can deal with the infection that was going on, deal with the pandemic that was going on, and yet provide the facilities, the treatment to as many patients as we could cater. So we shifted our OPD services to completely an online platform. And we conducted the follow-up sessions also with our patients on an online platform. It was challenging as such in the beginning, but gradually the patients as well as the staff became used to it. And it's going smoothly even till now. We are conducting online OPD sessions only now. In terms of the inpatient admissions, we conducted COVID mandatory RT-PCR tests before getting them admitted, and only the patients who tested negative were admitted. And during their stay, we restricted the entry of outside persons in the complex so that the patients and the safety of the staff was not compromised. So only the even the family members were, we tried that we conducted online family sessions between the patient and the family members. And there was a time where during the last week that even the staff stayed, even I and Miss Banerjee stayed at the center so that we can cater to the patients and we don't serve as a risk to the patients. So to prevent ourselves from getting exposed, we stayed for a few days when the peak was there at the center itself. In fact, as even with these measures, there came a time where a patient actually tested positive. So the patient tested negative in the RT-PCR when they were about to take admission, and after about a week or 10 days, they started showing symptoms very similar to COVID, and the test was still negative. So after 2-3 days, when the test results came, and again we made a retest because there was a suspicion of it being COVID, and the test came positive. We asked the patient what they would like to do. The patient was very apprehensive, clearly, because at that time the peak was there, and the patient was very fearful of being discharged and going back to the family because there was a risk of infecting the family members as well. So we successfully isolated the patient at our center in their room. We coordinated with the government facilities, with the government authorities, with the nearby government treatment centers, and the monitoring and treatment was all provided at our center itself in the isolation of their room. And the patient stayed for a month, recovered there, both from COVID as well as their substance use. So that was something which we took on as a challenge, and we decided that we have to help the patient rather than discharge them out of fear. So this is what the experience during the pandemic has been for us.
All right, yeah. It does sound like during the pandemic, safe house was a safer place to stay in, since it's like secluded and there's not a lot of.
Yes, definitely.
Okay. So that's all the questions that I had from my end. Can we now take questions from the audience?
Yeah, sure.
Okay. So the first question is, what is the treatment range at Safe House? If a patient is critical, is it possible for their family members to stay with them?
Definitely, in case of chronic cases, we allow the family member to stay with the client, and especially in a single occupancy room. So we have two categories of room: twin sharing and single occupancy. So definitely in single occupancy room, the family member can stay in chronic cases, and if the condition is severe, and if any other assistance, like we have physician also in team, so if any other assistant related to the medical condition apart from their doctor whom they are taking treatment from, apart from their doctor, if they want any other advice, then the physician is there to take care of that.
Okay.
We even allow the family members to stay for a short duration if the patient wants the patient is apprehensive in the initial few days. So we allow the family members to stay over with them for a week or so till the time the patient becomes comfortable, and then they can decide based on what they want to do.
Okay. All right. So let's go to the next question. How do you deal with extreme cases of addiction or mental health problems? Do you administer any sedatives on them?
So when we deal with extreme cases, obviously, like we mentioned earlier, this center is a completely voluntary center. So a lot of times when the patients are in critical conditions and they are completely intoxicated, they might be aggressive, they might be violent, and such patients are not really the they wouldn't find it comfortable to be here, and they usually are not really opting for treatment also at that stage. Patients who want to opt for treatment, usually even if they come in a critical condition, we call the physician, an assessment is done, I make an assessment, and definitely we don't administer sedatives as such, we administer medicines to manage the withdrawal. So whatever severe symptoms of severe withdrawal are there, we try and manage that by giving the appropriate medications, not necessarily sedatives.
Okay. All right. So the next question is, any tips for international patients who can consider safe house right now?
Okay. Definitely, the tips is like, as I said, it is the most comfortable environment we provide, peaceful and solitude also, if the client wants to prefer that. And also lots of recreational activities are there. Uh, we give the freedom of choice or to the clients, so that they can find out with whom they can relate and with whom the sessions they want to continue. There is no such as such. So definitely the tips are treatment should be in a it should be from like, as willingness should be there for the client, and the facilities we can assure the best facilities we will provide them. So, and the rest the treatment team is like, we all work in cordially with each other, and also we prefer the client prefer giving prioritize clients requirements and need, rather than imposing something on them.
Okay. Yeah. I think what this question also is trying to address is, what is the process of reaching out to safe house in case they want to?
Okay. We have a official number on our website, and also they can mail us at info@safehouse.co.in. In both the cases, they can ask us if they have any queries, and after that, if they want to see the facility, so we can organize the virtual tour for them. And also we can organize a video session, video interaction with Dr. Agarwal and me, so that they can have a basic understanding of what we are going to do and how will be our approach.
Okay. Okay. There's another question asking, are you planning to open up something in Mumbai or in south of India?
Not now, but yes, definitely in future.
Okay. There's another question asking, what's your success rate of treatment and relapse in your patients?
Dr. Agarwal.
So I would say that if we are talking about the follow-up rate, um, regardless of the relapse, we would say that we have almost more than 90% of the patients who are following up with us. Out of those, I would say that 70% have been successfully in abstinence phase. Recovery is a long process, so I wouldn't say recovery as such. In medical terminology, it's not really a term which is used, but I would say that almost 70% of our patients have been in remission or in abstinence phase, as with the ones that we have been following up.
Okay.
So,
Okay.
yeah, this percentage, now this is a very frequent question asked by people to us. This percentage can't be calculated in the population who are not coming back to us for
Yeah.
follow-ups. So we can only calculate on those population who are coming for follow-up. Among that population, we can say that what Dr.
Yeah.
Agarwal mentioned.
So
This is
people
the
who follow, yeah. So people who follow our advice and act on the measures that we tell them to take and follow the come for follow-ups and so in such patients it's almost 70%. And like I said, we have 90% follow-up at this stage.
Okay. All right. There's a question that I have. So you've been talking about voluntary cases. So do you see people coming with their families involuntarily a lot of times? And what do you do in that case?
Yeah.
Dr.
So
Agarwal.
should I go? Yeah.
Yeah.
So when yes, you're right that a lot of times there are patients who are the family members bring to us, or the family members call us for inquiring about admission where the patient is not willing to get treated. So our advice usually is that we definitely don't take up the patient for admission at that stage. We advise them to try and explain to the patient what would be the treatment process. We explain to the families what the treatment process would be. We try and call the family over to have a session with us, to have a meeting with us on OPD basis, and we explain to them what is happening, how they can tackle it. We try to train them instead of the patient, to so that they can handle the patient with much more ease, and they can explain the treatment modalities to the patient. And we also encourage the families to get the patient along for an OPD session with us, so that the patient can see the environment, be more comfortable with the treating staff, and that usually motivates the patients in most cases.
There is a stigma of rehab in the society. Okay, so that is also one reason why people are not motivated to go to a rehab. So definitely we try to instill the motivation in the client, and we from a recent experience, I can say, like almost 1.5 months, the clients family members were coming and following up with us, and then they decided to stay in the facility. It's a recent case. So we give the time to them to get convinced. Let them like take their own decision, because then only the outcome we can expect, the best outcome we can expect from them.
Okay. All right. So I think we're almost out of time, but I see one interesting question here. So can we take this one last question?
Yeah, sure.
Okay, so the question is, what has been the toughest challenge in treatment so far at the Safe House? Maybe you both can share your personal.
Dr. Agarwal, you can start.
So I would say that the biggest challenge is, I would say, tackling the comorbid medical conditions along with the substance use. This is something which is very problematic as such, because the family members expect a lot when you are sort of admitting the patient for one modality, but they also want to see the other modalities being addressed. So this is the biggest challenge. And if my personal experience would be, I would say that there have been incidents where the patient's blood sugar has been fluctuating, or the blood pressure has been fluctuating. So these are things which become challenges for us, because despite the medical care being there, despite the physician being there, this is something which we have to be very careful about in terms of monitoring. And this was something which I have faced as a challenge. Uh, Although we have tried to overcome that challenge by focusing majorly on, getting an assessment, a basic assessment with our physician first, and trying to keep their treating physicians, gastroenterologists, and any other physicians who are involved in the loop in the treatment.
Okay.
So I think this has been the challenge that I faced in one of the cases. Other than that, I think Miss Shraddha's video has
Video.
frozen.
All right, then I think we can stop with the questions.
Yeah.
So I'll be handing this over to Akansha. Before that, I just want to thank both of you, Dr. Agarwal and Ms. Shraddha, for joining us. This whole session has been very informative. Yes,
Thank you
Akansha.
very much. Thank you for inviting us.
Yes, Akansha, over to you.
Thank you so much, Rajnandini. So thank you so much, Dr. Agarwal, Ms. Banerjee, and Rajnandini. It was really an insightful session, and I'm sure it will help a lot of people in our network. And I'm sure people will know in detail now about Safe House Wellness, the treatment program, and the facilities, and it will really interest people a lot. But before we conclude, as in psychiatrist, do you have any message for the audience, Dr. Agarwal and Ms. Banerjee?
Sure. So my message to the audience would be that we sometimes start seeing substance use as a social or a moral problem. this is something which is the biggest, which creates the biggest stigma in the society for seeking treatment for substance use. And when we start seeing something in a social or moral construct, I think we start failing in understanding it as being an illness. So we have to start understanding that substance use and substance dependence is as such a mental illness or a mental disorder, which can be treated, and appropriate treatment has to be sought. That is something which I would like to tell the audience today.
Thank you so much, Dr. Agarwal. I guess we have lost Miss Banerjee.
Yeah, I think she's not.
Yeah.
I think there must be some network issue. Yeah.
So then in that case, maybe we can conclude. So thank you so much once again, all of you. It was great having you all today. And thank you to all our audience for the participation as well. And we'll be back with soon with another webinar. Till then, stay safe and have a great weekend. Bye-bye.
Thank you so much.
Bye-bye.
Okay, bye-bye. Thank you.
Bye-bye. Thank you.
Thank you, Dr. Banerjee and Dr. Agarwal.